And it's really a pleasure and an honor for me to be here today with you. So thank you so much for having me. I want to take the opportunity to talk with you as the community leaders that you are about what we're doing at VNA, the challenges that we see for our industry, the significant opportunities that I believe present themselves to our industry, and then also to talk a bit about board opportunity and how you as the community leaders for this very important organization in this very important segment of healthcare delivery can continue to support the work of the VNA and also of the 400 employees. I think that's an incredible statistic, and it's testament again to the leadership of this community. As you know, VNA, the Visiting Nurse Association of America, is the national organization representing nonprofit providers of home health, palliative care, and hospice. We have 170 agencies in 42 states across the country. And when I say 172, it's really many more than that because we're counting VNA of Treasure Coast as one agency, obviously, and you have several different boards and organizations and sites providing care. MedPAC says there are 3,200 nonprofit certified providers of home health services in this country. That's only home health, that's not hospice as well. We represent all of them. And as you do with the representation and the service for patients regardless of ability to pay, we are the voice of the nonprofit providers in Washington, in policy, in quality, in education, and in the quality and value that we bring to the healthcare delivery system. It's our honor to work for such a passionate and committed group of community leaders across the country. And frankly, I've only been with VNA for 2 years. But I have come to this industry with a recognition for that commitment and passion, and it's a true honor for me to work with the many leaders across the country. I've spent 25 years in Washington in healthcare policy primarily. I've worked with managed care organizations, I've worked with hospital organizations, I've worked with various segments of the industry. This by far is the most rewarding opportunity I've ever had to help lead the quality and advance the expansion of an industry, and it's an honor for me to do that. Right now, I think that we have some significant challenges confronting our industry. I want to assure you, however, that it's not just our industry that's confronting these challenges. We sometimes in home health and hospice, I recognize, think only about what's happening to us, the unfunded mandates, the administrative burdens, the reduction in pay, the reduction in referrals to our agency, the competition and the growth of other providers in our space. But I can assure you that working on a national level, we are by far the only segment of the healthcare delivery system that's been shoved through what I tend to think of as this funnel of reform and efficiency. Every other segment of healthcare delivery has been through it. Most of them have already gone through it. Many of them are still in the midst of it. But we in home health really in the last couple of years have had to turn our attention to what's happening in the broader environment around us. You think about hospitals and physicians and clinical labs and VNA. Every single segment of healthcare delivery has had new quality measures, new outcomes goals, new payment models, new delivery models thrust upon them. And it really has been home health's fortune on some level to have sat out some of that cataclysm, if you will, and revolution in healthcare delivery reform. No longer, however, can we afford to continue to do things the way that they've always been done. And when you think about the evolution of this industry, I tend to think about it in a computer language, if you will, and I think about the different versions of home health and hospice in this country. I think back to the origins of the industry in the 1880s with Lillian Wald in New York City, providing maternal and child health in the tenement houses of New York for an increasing class of factory workers who simply didn't have health care because it didn't exist at that time in the way we tend to think of it today. We think of version 2.0 as that version that came along after 1965 with the innovation of what was then truly an incredible opportunity for senior citizens to have health care that they'd never had before, and the implementation of the Medicare benefit. In that evolution, our segment of the industry moved more to a post-acute care model that we know today, where we're providing care for individuals as they came out of the hospital, as they aged in their home, in a way that they simply never had the opportunity to receive care. Do you know that in 1975, I'm sure many of you know this, the average lifespan of a senior citizen was 72 years. Today, 40 years later, the lifespan is 87 years. Much of the credit for that dramatic expansion in the lifespan in this country is to the implementation of the Medicare benefit for senior citizens, who were for the first time able to afford care and receive care when they needed it most, when they aged. This is a really important recognition that this version 2.0, this post-acute care model, is now 40 years old. And we have to begin to think about what 3.0 is going to look like. 3.0 is really what we see happening in so many communities across the country, and I tend to think of it as a population health model. This is where the opportunities for our segment of the industry really lie in the next 40 years. It's providing care for patients in their home and in their community across the full continuum of care, providing wellness and health promotion services, providing risk mitigation services to help identify patients with conditions before they become full-blown chronic conditions, to help better control and manage chronically ill patients and their conditions, to continue to provide the post-acute care support that we've always provided, to begin to implement palliative care models that really are the next generation of care that we will see, and then also to continue to provide and to expand the availability of hospice care in this country. That's what I see as the opportunities that we have for this industry in the future. And it's up to our organizations, like the VNA Treasure Coast, it's up to our boards of directors, such as those of you in the room, and it's up to the community partners to really help these agencies understand what are their opportunities, where are the opportunities for growth, what are the needs of your community, and how can we tack toward those opportunities by developing the programs and services and staffing models that can best support the communities, the patients, and their families, wherever they may be along that continuum of care, to support the services at the hospital, the services in the physician office, and to ensure a greater level of coordination and communication among all providers in the community. That's where we need to go. Now, I know that many of you who follow these things on a daily basis are aware of the significant regulatory and implementation activities around the Affordable Care Act. And let me tell you, living in Washington, D.C. and working in healthcare for the past 5 years has been quite the train ride, if you will. I've fortunately worked in Washington, I'm almost ashamed to admit this, going back to the Clinton health initiatives when President Clinton and his wife tried to implement healthcare reform during their administration. And there are a lot of similarities, frankly, in the Affordable Care Act and what was eventually enacted and what the Clintons were talking about then. Whether anyone wants to recognize it or not, there are a lot of similarities, particularly in the coordination of care and in the quality measures that have been implemented. But the last 5 years have been an incredible opportunity to witness rapid-fire change in our healthcare delivery system. One of the most telling statistics is really in the growth of accountable care organizations. I work very closely with an organization that tracks and supports resources for accountable care organizations. When the Affordable Care Act was passed in 2010, there were 3 so-called accountable care organizations. And these 3 organizations were really the impetus for the inclusion of this model in the Affordable Care Act. Many of you know that an accountable care organization is designed to be a community-based model of care that encompasses hospitals, providers at all levels, including physicians, to ensure that healthcare is an engine of innovation in an industry and providing care and coordination at all levels. Today, as of actually December, there were over 646 designated accountable care organizations in this country. Almost 300 of them are receiving some sort of funding through grants provided by the Affordable Care Act. For a delivery system model to go from 3 in 2010 to 640 some less than 5 years later is nothing short of unprecedented. And it's really a testament to how quickly things are changing in healthcare delivery. And I tell you that again to reinforce that it's not just home health, it's not just hospice. It's everybody being forced to look at healthcare delivery in a new way. One of the things that we are most concerned about is how we can integrate into these accountable care organizations and other delivery models. Whether it's an accountable care organization or perhaps a smaller patient-centered medical home, these are the delivery models of the future. These are, I think, some of the most important opportunities that we have in the home health and hospice segment, that we can identify the needs of these organizations and we can better support them. Because at the end of the day, not all care can happen in the four walls of the hospital or in the four walls of the physician office. We know you are the people who are providing this care and supporting this care in your community. It happens in the patient's home. It happens at the incredible facility that I toured this morning, Hospice House. And it happens in the buses and the blood pressure fairs that you have throughout various locations in your community. This is the opportunity for organizations like VNA, the Treasure Coast, to better coordinate with ACOs to help innovate and develop those accountable care organizations, to work with physician offices to develop and structure patient-centered medical homes so that you are providing care for their patients. This is the opportunity for VNA Treasure Coast and other VNAs across the country to identify the services at which you excel, the services through which you can help accountable care organizations, hospitals, and patient-centered medical homes drive their quality measures and outcomes. I have been working with an agency in New York who was not able to participate in their accountable care organization. They were effectively shut out. To her credit, the CEO of that VNA repeatedly beat on the door of the hospital administrator in her community, went to him repeatedly, and called me repeatedly to say, what is it the hospital needs to be focused on? What are the measures they're held to? How do they get paid? Help me understand how this is transitioning. So I helped her outline a platform of the specific quality measures that their hospital was going to be measured on. And we looked very closely at their programs, and we looked at the outcomes, the patient outcomes for the programs that they had. Key among those, what is the readmission rate for those patient populations? What is the ED visit rate for those patient populations? How are the diabetics controlling their conditions? How are the heart failure patients controlling their conditions? What's the cost for a joint replacement patient? We put all this on paper, and about the third or fourth time she went back to that hospital administrator and kept putting these numbers under his nose and saying, look, your discharges need to come to me because I'm better at providing care for these patients, and I can help you improve your outcomes, and I can help you reduce your costs, and I can help you be a better hospital if you work with me. He finally agreed. And he said to her, you know, I was ready to write off the VNA because I really didn't understand what you did, and I thought you were a bunch of nice ladies who were out there raising money to support things. But at the end of the day, these two organizations have developed such a strong partnership that this hospital's quality metrics have improved dramatically. And the CEO of this hospital now goes out and speaks to other hospital CEOs to help them understand the significant value and quality improvement that can be derived by partnership with the local community VNA. Another story is Atrius. Atrius is an ACO in Boston. They've been participating in the Pioneer ACO program funded by CMS. Atrius looked around and tried to find providers in their community that they could partner with. One of the providers that they worked with was the VNA of Boston. They liked them so much, they did so well, their partnership was so successful in quality measures that they bought them. And so now the VNA Boston is a significant part of Atrius Healthcare, and the CEO of Atrius will go anywhere I ask him to go to talk about the value of visiting nurses and the programs and the partnership and how they have worked together to identify the specific patient populations that they can serve. So yes, there are significant challenges, and some of those challenges are of such complex administrative detail that we could spend days talking about them. And frankly, they are the result of misguided bureaucrats in Washington who need our help and guidance on how they can do things better and more efficiently. And believe me, that's a big part of my job. But there are also significant opportunities. And it is an incredible day for us to sit in Washington and to talk with folks at MedPAC, at CMS, at HHS, at the American Hospital Association, and at other partners and allied organizations to talk to them about the value and the quality that home health and hospice providers bring. One of the most significant opportunities that we've been talking about recently is in palliative care. Palliative care, if you will, is really designed to support patients in that space between a post-acute care episode and when they go to hospice. And that's a broad generalization, I recognize, but there's quite a bit of research that indicates that individuals begin to decline in the last 2 to 3 years of life before they're eligible for hospice or need hospice, but they need something. They need some coordinator for their care. It needs someone to keep them going back to the hospital repeatedly. It needs someone to keep them out of the emergency department. And they're not going to see their physician on a monthly basis, or they may be seeing 7 physicians on a monthly basis. Palliative care is the single most important opportunity that I see for our industry that we aren't already involved in. And I know that many of our agencies across the country are looking at how to develop and implement palliative care programs, or in some places we call them advanced illness management programs. There's a significant opportunity, both on the quality side, on the program development side, and on the finance side, for all the partners involved in a community who can better support their patients and their families in their community as we see these patients begin to decline and they need our support and they're not currently getting it. That's a key example of opportunities that I see arising, and I think you're going to see a lot of policy developing around palliative care and advanced illness management programs in the coming year. Hospice is another incredible opportunity for us. And I mentioned earlier, I had the great fortune this morning of being given the grand tour of Vero Beach and also seeing the hospice house with Anne-Marie and Carol. What an incredible facility that is. My own personal experience with hospice prior to taking my role at VNA was really limited to my grandmother's passing many years ago in a small town in Ohio. She was in hospice, she was in an inpatient facility. It was nothing compared to what I saw today. And frankly, I've been to other inpatient facilities and hospice facilities across the country in my role with VNA and still have never seen anything like that. It is a testament to the community support, the community leaders, those of you in this room, to the unwavering commitment and dedication and passion of Anne-Marie and of Carol and the other leaders on your board and in your VNA organization, that you have what I consider to be one of the most incredible models for hospice care in this country, in your community here in Vero Beach. And I asked Carol and Anne-Marie this morning if in fact this had served as a model for others. Because I can't imagine that you don't have a steady stream of people coming into this community to say, how did you build this? How did you do this? Why did you design it this way? How can we do this in our community? I'm going to start sending people here. I'm going to refer them to you. Well, especially after being given the tour this morning, right? I've seen everything, and I'm just going to sign Carol and Anne-Marie up to continue to give those tours. But it's an incredible testament to your leadership and commitment that you have this facility. What I was disappointed to hear, and this will come as no shock to any of you, is that most of the patients who come to Hospice House are there for 24 to 48 hours, or maybe just a few days. It's such an incredible resource in your community. And I understand the stigma of hospice. I understand the stigma of death panels. I understand everything that creates this reluctance for people to recognize they need hospice, for physicians to refer patients to hospice, for family members to agree that their loved one is ready for hospice. I truly do understand all of that. And yet, we have so many opportunities to work with physicians, to work with our hospitals, to work with others in our community, to educate on the value of hospice as a support for a family, as a support for a patient. It's not someplace you go to die, it's someplace you go to be supported and loved and cared for. And I think that was evident from the moment we pulled up to the front of Hospice House. And I'd love to see that message resonate more clearly throughout your community and other communities across the country. And so palliative care and hospice are two of the areas that I think I know the VNA of Treasure Coast is focusing on, and that I see happening increasingly across the country as significant opportunities for our segment of the industry to really expand along that continuum of care that I spoke about. And if you think about that expansion, focusing on those areas that we have not in the visiting nurse and home health industry provided care in, really that's going to be our version 4.0. We exist in this country because there is a need for the type of compassionate care that our agencies provide. And in no way should that be overshadowed by the high quality care that our agencies provide as well. It's an important and dual goal that many providers in this country simply don't share. And it's my honor to be able to represent them. As members of the board and as community leaders for this agency, I would hope that you also go into your communities to talk about the value that this community program brings, that the leaders of this community program provide, and to ensure that your community neighbors and others on whatever other boards you're sitting on the hospital boards, on the physician practice boards, on the bank board, know the value that the VNA Treasury Post and your affiliates and Hospice House provide to your community.